So we have gathered here to sit around Dr. JJ, who's going to help us clear up some of those allergy test myths that are fact from fiction. Hi, doctor. It's nice
Hi,
to have you
doctor.
here.
Welcome. And what are the most common allergies?
So in the office setting with kids especially, I think we see environmental allergies. So that would mean hay fever, sneezing, coughing, runny eyes, watery nose. A lot of our crew right now have environmental allergies and everybody's sniffing and sneezing. And food allergies, which of course are a hot topic. They are an important problem, an important public health problem in the United States right now. And there's lots of studies and research that's being devoted into why we're seeing rising numbers and how we can test appropriately, which is really the important
That's the key, appropriately.
It is.
What's the situation? What are the tests?
Well, there's actually a cottage industry out there of folks who are doing all kinds of alternative allergy testing that is not evidence-based or science-based.
Alternative to what?
Alternative to what is the gold standard that's been borne out by science. So, for example, when we're testing for food allergies, for example, the most important thing is that we get a good history of the event. What was inhaled, what was touched, what was ingested, what were the circumstances there. So the history is really, really important. And we don't want to run gunshot panels of tests without a really good history, because you're likely to get what's called false positive results. You might have a test result that says you might be allergic, but you've never clinically been allergic. You might eat bananas happily or eat peanuts happily, but a gunshot, a big panel may not tell you that. So history is so important.
When you say history, are you talking about the history of what we just consumed or family history?
And family history is part of it too, but it's not diagnostic. It just leads you into that courtyard of having a higher index of suspicion.
Okay.
I know you said that, because we were talking before, that it's dangerous because you had a patient one time that went through this and ended up being really sick. Explain
so
what
this is why this segment's so important to me. I had a little guy in my practice about 10 years of age, and his mom took him to her alternative medicine practitioner. She ran a panel of tests looking at his ADHD and allergy symptoms. And this panel, unfortunately, was not a true allergy panel. This practitioner told this mom that he was allergic to everything and that he had to take all these supplements. And this kid developed anorexia nervosa. This triggered
an eating disorder?
An eating disorder,
wow.
Which he is still recovering from. So believe me, there are a lot of people out there who would like you to believe that their kinesiology, their cytotoxicity, their neutralization, or their IgG testing is what is valid to diagnose an allergy, and they are not.
I will have to turn to the ladies that are all sitting here, all moms, sitting here going, okay, are you concerned about this with your kids? Do you see allergies?
My kid has a lot of allergies.
Yeah.
He actually has the all nuts, the eggs, sesame, and like a whole bunch of, and I have allergies. I'm allergic to people who have gluten insensitivities. No, but I am really worried because we get skin tested, but I've never done blood testing. So do I need to do both? Do I have to like cross compare?
Well, let's talk about the sort of top contenders here for good testing. So first of all, your history, as I mentioned before, is very, very important because we play detective in the office, and an allergist will do that too. So we really ask an excruciatingly long and detailed list of questions for a reason. Then second of all, the gold standard of diagnosis actually for food allergies and for some environmental allergies is something called a direct challenge. And a direct challenge means that in the presence of an allergist, right in the office, you will be given a tiny little amount of the food that we suspect, especially if it's confusing. You eat a bowl of mixed nuts, you get a reaction, you're not sure which one. But under medical supervision and direct observation for a couple of hours, a direct food challenge is the gold standard.
But you know, Dr. JJ, that could be expensive, though, to go for a couple hours in a doctor's office and do all these.
Well, you know, when you do a direct food challenge, you do it in an allergist's office. That is a subspecialty appointment. It's really under the circumstances where there's confusion as to your diagnosis. Sometimes it's really clear when you have a reproducible, time after time, say you eat peanut, time after time you get hives or wheezing or whatever.
Right.
You don't need to have a direct food challenge for that.
Right.
You don't. Yeah. But when there's confusion, that is one of the options. The second option is skin prick testing. And I think we have a little video here. So skin prick testing is used commonly for environmental allergies to see if there's something in your environment that you can control. Oftentimes it's to grasses, to pollens, sometimes to cats or dogs or things that you might be able to control.
They're pricking the skin there?
They're pricking the skin with samples of allergens.
Okay.
And then watching for what are called welts or hives, and you see these sort of
one
raised pink areas there. And a measurement is done of each of these, and this is basically a road map here. All of these are identified on a grid in a chart. So this is helpful when your history is confusing. It's also helpful for environmental allergies. And some kids, though, like for skin prick testing, they may have bad enough eczema on their skin that we can't do this kind of testing. And so that's when we turn to blood testing. So blood testing is not as sensitive as skin prick testing. Skin prick testing will really tell you, if there's a welt there, likely you may have a reaction to that. If there's not a welt, chances are you're not allergic. Blood testing, on the other hand, will tell you that your immune system is reacting, but you may not clinically be allergic. So what we look for in blood testing is something called IgE, say specific to peanut or to milk. My IgE to peanut is actually quite high, but I eat peanuts every day, so I'm clinically not allergic. But say my doctor was following me over time to see if I outgrew my allergies. If IgE falls with time, then we know that we are probably outgrowing it. So this is why IgE comes in handy when we're trying to ascertain if a kid loses their allergy or if an adult loses their allergy.
But after the tests, is there good news, or is it just like, gotta live with it?
Well, there's good news for most things. So most environmental allergies can be controlled with medication or with immunotherapy, which are allergy shots.
Sure.
Most food allergies, thank God, are outgrown except for shellfish and some nuts because they stick around longer and they may stick around for life. But very, very important to know that there's a good outcome for a lot of kids.
Well, good news for Kira, we have removed all of those gluten-free people here, so you should not have an outbreak.